Okay, well, we'd like to welcome everyone here. So thank you for all joining us. We're so excited for you to be here. And for those who are on Facebook Live, so we're great, excited to have all of you here. And so for our Facebook Live, I'm sorry, I'm trying to share my screen, and so I think that you can see the slides. That's probably the best that we're going to be able to do. So, but I'm very, very excited to share all this information with you. And my name is Dr. Catherine Taketa-Wong. I'm a naturopathic physician and licensed acupuncturist, and my specialty is in working with children with autism. And we'll get a little bit more into my background and my story and everything pretty soon. But just to get started, I just wanted to see, out of the people that are here in person, how many of you are actually more interested in the treatment of autism? Okay, and how versus treatment versus prevention? So yeah, so how many of you are more interested in the treatment of autism? Okay, and so out of those who are here, do you have a child or a loved one with autism? Okay, and then out of the other people, who are interested more in the prevention versus the treatment of autism? Yeah, okay, so that's helpful. And then also, Caitlin, could you get on the Facebook Live and just monitor if there's questions or comments or things that come in, and just let me know if there seems to be any issues as well with the Facebook Live. So yeah, so like I said, I'm really excited to share all of this. A quick thing is that we will be passing around, for those who are here in person, if you want a copy of the slides, you can go ahead and then sign up over here. Just put your email, and then we'll email you copies of all the slides. So we have that. Caitlin, could you get a pen, and then just we can pass this around. So back there, that's Caitlin. She's my office coordinator, my star amazing office coordinator. I'm so grateful to have her. So we'll have this going around. So you can sign up if you want a copy of the slides, so you don't have to worry about writing everything down. And for those who are on Facebook Live, if you're interested in getting copies of the slides too, you can also message us on Facebook, and then just let us know, send us your email, and then we'll be happy to email you a copy of the slides as well. So for another thing, for the sign-up sheet, I do offer a free 15-minute phone consult. I'll be talking a little bit more about that, but that's an opportunity if you have specific questions, and also to get just individualized help and attention for your specific situation. So you can sign up for that. And then if you also want to sign up for our e-newsletter, we have that as well. So that's on the sign-up sheet. And then I do have a few openings tomorrow that we carved out for the free 15-minute phone consults. We have a few of those slots. So if any of those work for you, then you can sign up for those times as well. And if none of those times work, then you can just put your name, and we'll just call you, and we'll figure out a time that'll work for your schedule. Okay, great. Okay, so the big question, I know there's been so much interest and controversy and all of these things. What causes autism? Big question. And so today I just want to give you some insights into the prevention and the treatment of autism. And there's a lot of new research. There's a lot of things I'll be going over tonight. If you have questions during that time, you can feel free to answer or to ask that, and then I'll also be taking questions at the end as well. And just for those who are on Facebook Live, I'll be repeating the questions just so that people on Facebook Live, because I'm close to the microphone, so that the people on Facebook Live will be able to hear the questions as well. Just going down to, let's see, is that working? Technology, sometimes it doesn't want to cooperate. There we go. Let's see. Okay, let's see if this works. Okay, there we go. Okay. So again, just a general disclaimer, this information is for general educational purposes, and it shouldn't be construed as medical advice. It doesn't replace the need for individualized care by a physician. So some questions for those of you who do have a child or a loved one with autism. So some questions. Do you feel frustrated because you feel like you can't connect with your child, or that your child can't connect to other people? Do you wish your child had better behavior? Are you tired of constantly worrying about your child's safety? And do you wish that your child could socialize better and have friends? And are you stressed about the cost of caring for a child with autism? Because all of these are very real factors. And Caitlin, is the Facebook Live looking okay? Oh, okay, okay. So I just want to share that you've come to the right place and that you're not alone, particularly for the families who are living with autism. That is definitely something that we want you to know. There is a community. There's many nonprofit groups, and the Foundation is one of those that I am a part of. Also, Talk About Curing Autism. Taka Hawaii, they're a great group to get involved in. Also, Autism Society of Hawaii. So there's a lot of groups really to just let you know that you're here to be supported. And one of the things I'd ask you is just imagine if your child could communicate easily and effectively, that they could have friends, they didn't have problem behaviors, and if they could pay attention and learn in school, and also if you didn't have to constantly worry about your child's future. And what would that feel like for you? So that's one of the things that I just want you to keep in mind as you're going through this. Because a lot of things we'll talk about those things and how we can address a lot of those conditions, those concerns. So I just want to share with you a little bit about my background. My younger brother is an adult now on the autism spectrum. That's really how I got into all of this, got on this journey. So this is a picture of me with him when he was brought home from the hospital. So just a little bit about him. He had constant ear infections from the time that he was a few months old until he was 18 months. He didn't start babbling until he was 3, and he didn't have any words until he was 4 years old. And all my life, I was really focused on helping him and looking to see how I could be able to help him to better improve, to be able to have a better life, to be able to not have some of the struggles that he did have. And as I got older, I did my bachelor's degree in speech pathology, but then I started to learn about medical causes behind autism, and a lot of research has come up finding that there are very real medical conditions that can underlie the syndrome that we call autism, and that if those things were treated, that we can see many of the symptoms of autism improving. And so that was where I was actually looking into conventional medical school, and then as I looked into it, I found that conventional training really didn't have training in all of this neuro research, and I discovered naturopathic medicine, and that with naturopathic medicine, they did have a track where you could be trained in all of this research. And so that was why I ended up becoming a naturopathic physician. And I've also been trained specifically through the Medical Academy of Pediatric Special Needs. It's also called MAPS. So they train medical doctors, naturopathic doctors, osteopathic doctors in all of this neuro research. And this is my brother. Fast forward many years. He graduated from high school with a diploma. He earned his Eagle Scout Award. He got a certificate in Windward Community College, and he's been working at a local diner now for over 10 years. It's actually been close to 14 years now. So I'm really proud of all the accomplishments that he's done in his life. He still has struggles. There's still things that we're working with, but he's really come a long way. And that's really one of my greatest joys with him. So today you'll learn research-based insights into the cause of autism, causes, I would say, and how you can apply this evidence on a practical level to both treat and prevent autism. So the causes of autism, there are certain genetic conditions that are associated with autism, but if you add up the total of those only come out to about 21%. So that leaves us with over 79% of children with autism where there's not a clear genetic correlation. So what about all the rest of our kids? So the classic definition of autism spectrum disorder, I'm showing you these 3 circles over here because there's that combination of concerns with communication, socialization, and behaviors. But there's a paradigm shift now in seeing autism as a biological disorder. And so there are 4 main systems here that I'm going to go over. The neurological system, which involves the brain and the nerves, the digestive system, the immune system, and the metabolic system. So all four of these things are things that I commonly see being out of balance in children and adults with autism. So there's a variety of new research that's been found to identify biological causes of autism. And these are just some of those research studies. If you get a copy of these slides, on that link down there, you'll find a listing to literally hundreds and hundreds and hundreds of research studies. So this is definitely very much evidence-based. The typical course that I see with most children with autism is that it's a slow, steady, gradual improvement. It's not a magic pill. It's not tomorrow everything's all cured and better. I wish that were the case. But the typical course is that we see slow, gradual, steady improvement. But definitely after certain interventions, we do see clear, oh, parents say, oh, okay, this really helped with his constipation, which helped with his behavior. So that's a typical course that I see. And there are cases of children that I've worked with who have essentially what we would call recovered from autism, where they no longer qualify for an autism diagnosis. I would say that that's a minority of cases, but that the majority of children that I see, definitely we see clear, definite improvement. And so that's what I found in my clinical practice. So just to touch on all of these, there's a lot of information I'm gonna go over. I'm gonna share as much insight as I can into all of this in the short time that we have, and then at the end I'll show you how to take this a step further. So the neurological system, brain inflammation. It's not a life-threatening type of brain inflammation like meningitis, but there is documented evidence of inflammation in the brain. And so if you look at these slides, the cells over here on the right-hand side that are stained blue, those are all cells that are associated with inflammation. And then, on the left-hand side, the cells that are stained dark purple are all cells that are associated with inflammation. So why is that the case? Well, I'm going to share with you, there are several different causes of why there can be inflammation affecting the brain. This is one that's really exciting. This is something that was only discovered in 2005. And so it's very new. Most pediatricians, even developmental pediatricians, pediatric neurologists, many of them are not familiar with this research. But this is very exciting because it is actually a potentially reversible cause of autism. And that's from the research studies. So this over here, this rectangle that you see in front of you, the big rectangle, that represents a brain cell. And folate is a B vitamin that's very important for brain development. Folate needs to get into the brain in order to have normal brain development. But what's happening is that if you see these yellow things down here, so there's some yellow things over here that look kind of like little arrows, and those are actually antibodies, which are proteins that the immune system makes. And those are actually blocking folate from getting into the brain. And so as a result, then if folate can't get into the brain, you don't have normal brain development. And this is a condition that we see in about 75% of children with autism. So it's very common that we see this condition. And the exciting thing about this is that there is a treatment for it. I'll actually go back to the previous slide. So there's a treatment for it. You can give something called folinic acid, and folinic acid is the active form of folate. And if you give folinic acid, and that is something that can be given orally, that it will actually bypass those yellow things that are blocking folate. And with folinic acid, it can actually get directly into the brain cell. So that's the treatment for this condition. That's one of the treatments. Another thing for this condition is that it's been found that milk will increase the levels of those antibodies, those yellow things. So those yellow things, not only are they blocking folate from getting into the brain, they're also attacking that one part of the brain cell, which can cause inflammation in the brain. And it's been found that milk, so specifically cow and goat milk, also camel milk as well. Some of you may have heard of camel milk as a treatment for children with autism, but if they have this condition, then that can actually cause problems. So cow's milk, goat milk products, and then also foods that are derived from cow's milk, so cheese, butter, cream, all of those things. If the child has this condition, then there's a protein in there called folate receptor antigen. And if the children have this condition, then that protein will actually cause the body to make more of those antibodies, those yellow things. So basically, milk products, if you have this condition, can equal more brain inflammation. So if you see on the left-hand side over here, what they did was, I'm just going to step over here. So over here, you see these are the levels of on the left side, those are the levels of the antibodies initially. And then if you see in the middle of the graph, then the antibody levels went way down. This is after 6 months on a dairy-free diet. Then the antibody levels went way down. You can see them at the bottom. And then when they reintroduced milk into the diet, then the antibody levels went way back up. So you can see on the right-hand side, it went up. And so this is something that's showing that milk can increase the levels of those antibodies. So as I mentioned, folinic acid is something that is available. It's available as a prescription. It's also available over the counter, but that is one of the treatments for it. The other treatment is to take dairy out of the diet. And then folic acid, most people aren't aware that folic acid is actually a synthetic form of the vitamin folate. And folic acid is actually something that should be avoided in this condition because folic acid won't get into the brain. And just to make it simple, it makes it more difficult for folinic acid to get into the brain. So this is a quote from one of the research studies. There were 2 patients in this study who were young, and they were ages 2 and 4, and they were diagnosed early, and they received the treatment, so the folinic acid and then taking dairy out of the diet. These children were actually cured with full recovery from autism and their neurological deficits. Children who are older, ages 4.9, so essentially 5, 8, and then 11.9, that they didn't recover, but they did show improvement in their neurological deficits. So meaning neurological deficits, meaning speech, language, cognitive function, behavior, social skills, all of those things. And I will say that I've worked with adults on the spectrum. I have someone that I'm working with now who is in her 70s, and she has seen some improvement. Not dramatic, but she has seen some improvement. And so parents come to me and they say, is it too late? I would say it's never too late. And never give up on your child, even if your child is an adult. So this is more research finding that besides just this particular condition, there are other types of antibodies that attack the brain and so are causing brain inflammation. There are also other kinds of immune system problems. So the autoimmune conditions, what I mentioned, the one that I went over with folate, that is actually an autoimmune condition, meaning that the immune system is actually attacking that one part of the brain. And so that's not normal. Normally, your immune system is supposed to attack bacteria or viruses, things like that can cause disease. But in autoimmune conditions, your immune system is actually attacking your own body. And so in children with autism, some of them do have conditions where their immune system is actually attacking their own brain. We do also see problems with chronic infections as well, yeast, fungal infections, viral, bacterial infections, allergies, eczema, and then inflammation. So these are just some examples of immune system issues. So you can see the child that has dark circles under their eyes. That can be a sign of allergies. It can also be a sign of sleep problems. Eczema, you can see the child on the left with all the rashes and everything. And then also you can see toenail fungus. So that can sometimes be a sign of a weak immune system. These are just some more citations. Skip through those. Gut problems, digestive problems. That's very, very common. And it's honestly rare that I see a child with autism that doesn't have some type of digestive problem. And so food allergies or sensitivities, problems absorbing the nutrients. Dysbiosis just means that there's an imbalance in the good bacteria. Sometimes there's too much bad bacteria. Sometimes there's not enough of the good bacteria. So there can be problems with that. There can be inflammation in the gut, in the digestive system, and there can be distress caused by all of those things. So These are common symptoms that I see in children with autism. So constipation, diarrhea, abdominal pain, food allergies, flatulence. I have some parents that are like, oh my gosh, my child will like fart from like down the hall and it'll just clear out the whole house, you know, because it's like so bad. Bloating, and then acid reflux as well. So this is, unfortunately, some parents, some of you guys are familiar with this, fecal smearing. Some of the kids with the sensory issues will smear their poop all over the place. Candida esophagitis. So on the left-hand side, this is a picture of a child's esophagus, their throat. And normally, it should be nice and pink the whole way down. But you can see on this one that there's a whole bunch of these yellowish kind of things. And that's actually yeast that's growing on the inside of the esophagus. And so for that child, it was causing a lot of pain in the esophagus and inflammation. Parasites, there's a little bug over there, our nice little friend. And this is a quote from a paper that was published by Tim Bowie. He's a Harvard pediatric gastroenterologist or a digestive system doctor. And he said that sudden and unexplained behavioral change can be the hallmark of underlying pain or discomfort, especially for our kids who are nonverbal or who have difficulty communicating and say, my tummy hurts. And so instead we see behavioral problems. And this is a child who had self-injurious behavior. She was scratching herself, biting herself. So you can see the pictures of her arm and her face. And it turned out that she had esophagitis or inflammation of her esophagus. And so you can see over here a picture of her esophagus. Normally the esophagus should be really nice and smooth and pink. But you can see for her esophagus, there's a lot of redness and there's a lot of bumps there. And that shouldn't be present. And so those are all signs of inflammation. And that was actually the underlying cause of her self-injurious behaviors. And so her self-injurious behavior actually resolved with treating the acid reflux. I also see many children who are aggressive, who are attacking family members or other people, and sometimes it can be an underlying sign of pain. And so that's a very, very common thing that I see. And honestly, with many children and adults who are self-injurious or aggressive, I would say 95% of the time it's due to some kind of underlying pain. And if we can figure out what that is and get that resolved, then their behavior will really improve. Another thing, pressure-seeking behavior. A lot of children will press on their abdomens. They will press their tummies on the bed or on the side of a table because their tummy hurts. So just like if you or I had a tummy ache, we tend to press our stomach and then kind of lean over, you know, because our tummy hurts. Well, a lot of our children will do that, but they won't tell us why. And so if your child does that, that's another sign to look for. Metabolic problems. So these are all different types of metabolic problems that can be commonly present in autism. So mitochondrial disorders, that's a common one. Mitochondria are like the batteries that power our cells. And so if you think about a toy where the battery is getting low, the battery kind of starts to slow down and the toy starts to slow down and starts to move really slowly, right? And so that can be the case in some of our kids with autism. The mitochondria, they're like the batteries that power the brain. They power the gut. And so if your child has mitochondrial disorders, often they'll have constipation and they can have low energy, low muscle tone, can be tired easily. And then also seizures are a common one that's present with mitochondrial disorders. Liver detox. The liver is like our filter, and so our liver has to filter out all the toxins that we get exposed to. And if your liver is all gunked up, if you picture a drain that's gunked up with a whole bunch of stuff, then you know that stuff is not going to drain out, right? And that's like the livers in some of our kids, where the liver is kind of like plugged up, it's not working well, and so then it's not able to detox very well. And so then toxins can build up and cause problems. Also thyroid problems, adrenal problems are other things that I see. So the big question I get all the time, vaccines. Do vaccines cause autism? That's like, I get that so often. And I will say that the answer is it's complicated. I've seen some children who have never gotten a vaccine in their life and they have autism. I've seen other children who are the other end of the spectrum, who were developing completely normally, meeting all of their milestones, having no problems, no signs of autism, even children who were older, children who were 3, 4, 5, you know, and there's one case that where, you know, there was a child who had an adverse vaccine reaction at 16 years old and had other issues, but after that received a diagnosis of autism. So I've seen those cases where a child was completely normally developing and then got a vaccine and then lost all of their language, started screaming for 3 days straight, you know, like started banging their heads, and then was diagnosed later with autism. I would say the majority of children that I see with autism are kind of somewhere in between, where it's the parents are like, well, I'm not really sure. I mean, it's not like there was a really clear, they got the vaccine and then the next day they lost all their language and they were banging their heads and, you know, that kind of thing. But there's questions. The thing is that, I mean, a lot of the research studies, you know, there's all these research studies saying there's no link between vaccines and autism. A lot of those studies are looking at the whole entire population. And of course, the majority of people receive vaccines and they never develop autism, right? So it's clearly not vaccines cause autism, because if that was the case, every single person who got vaccinated would develop autism, which is clearly not the case. But the thing is that what I see in many of the children that come into my practice is that they have genetic conditions or metabolic problems or other types of conditions that can predispose them to having adverse vaccine reactions. So it's a combination. So it's a combination really of genetic factors as well as some kind of environmental factor. And I've seen other environmental factors be triggers, not just vaccines. I've seen children who have had an exposure to a large amount of heavy metals or other types of toxic substances who have then developed autism. And other people around them were exposed to the same thing and did not develop autism. So why is that? Mitochondrial disorders is one of those things, because mitochondrial disorders, it is known, and I had the research citation, that if you have a mitochondrial disorder, you have an increased risk of having problems, of having an increased risk of having adverse vaccine reactions. Also, going back to the liver detox that I talked about, so if our liver is our filter, and our liver has to filter out all the stuff that we're exposed to, if your liver is not working well, then that can also be a risk factor for having adverse vaccine reactions. Thimerosal was taken out of most of the childhood vaccines, but there are still other additives like aluminum and formaldehyde is a preservative that's commonly in many vaccines. And for most people, if your liver is working fine, it can break all those things down and get out of the body, it's fine. But if your liver has problems being able to break those things down and get it out of the body, then those things can build up in the system and then it can cause problems. So it's, so again, my answer, do vaccines cause autism, is complicated. Liver detox. Are any of you guys cold in here? No? Okay, some of you guys. Oh, okay. Caitlin, could you check? I think some of the fans in the AC. Maybe we could turn off like the fan or something. Thank you. I'm in a long sleeve and I'm getting cold, so I was like, I think some of you must be cold. Liver detox problems, like I said, there are certain genetic mutations that can affect liver detox, and that can also explain why some kids have problems with it and others kids don't. So toxins, like I said, can accumulate and cause more problems. And a lot of those liver detox problems, specifically something called methylation, is treatable with specific types of herbs and vitamins. So this is getting more into the prevention part of the talk. So if you see this map over here, this is a map of Texas, clearly, and it shows in the upper left-hand corner the autism rates. And so the white squares are, you know, no, or actually, sorry, the yellow squares are very low rates. The blue squares are increased rates. And they also looked at the map on, in the state of Texas this was on chemicals, so facilities that were releasing toxic chemicals, and then also basically levels of toxicity by the different counties. And if you look at those two maps, it's almost like you could put them one right over the other. So there is known that in areas where there's a higher toxicity load, there is a higher risk of autism as well. So some of those toxins, I'm going to go through some of those. Mercury is definitely one of those. Silver or amalgam fillings, those can be up to 50% mercury, and they do all have mercury. And so it's been studied specifically in mothers during pregnancy. So there was a study that found that women who had more than 6 amalgams had a 3.2 significantly increased risk of having, that they were more likely to be diagnosed with autism in comparison to women who had fewer than 5 amalgams. So dental fillings, these are recommendations from a kind of a compilation from Natural Resources Defense Council, March of Dimes, and also the support group TACA, or Talk About Curing Autism. So dental fillings, so if you're pregnant, breastfeeding, or if you're planning to get pregnant, definitely do not get amalgam or silver fillings. There are other types of fillings, and at the bottom I put alternative fillings, so glass ionomer, porcelain, gold. There is a filling called a composite resin. Some of those do have BPA or bisphenol A, and that's another toxin that's been associated with autism, so I'll talk about that a little bit more. And there are crowns that are stainless steel, so those are all options. If you do get a composite resin, trying to get a BPA-free composite resin, because the composite resin is basically plastic. During pregnancy, if you are pregnant and you have amalgam fillings, do not have them removed, because even if you're having them removed by a dentist who's properly trained, the process of removal is more likely going to release more mercury into your system than if you just leave it there. So if you're already pregnant, do not have those fillings removed. However, if you are not yet pregnant and if you're planning on becoming pregnant, definitely if you do have amalgam or silver fillings, I do recommend having them removed by a dentist who's properly trained in safe mercury removal. That is really important. A lot of conventional dentists will say, oh, it's no problems, the mercury isn't released into the system. I have tons of patients where I've done tests, we've done urine tests, blood tests to look at their mercury levels, look at heavy metal levels, and almost 100% of the time, when people have mercury fillings, their mercury levels are usually elevated. And so I know that it is getting into the system because I have hard laboratory evidence of that. And often, some people have symptoms, some people don't, but that also depends on how well is your liver able to get it out of the body, right? So, but definitely on lab tests, I do see mercury levels being elevated. So it does get into the system. Mercury in fish, I know this is a little bit small, hard to see, but again, if you request the slides, then you should be able to see this. Mercury in fish, so definitely the bigger the fish, the higher the mercury levels. So definitely these are fish that should be avoided during pregnancy, and this is from the American Pregnancy Association. Shark, swordfish, king mackerel, and tilefish, and then we have a listing of all those others. Tuna, marlin, and it has the Japanese names too if you're eating sushi, so that you kind of know how to recognize that. Sushi with lower levels of mercury, so these are types of fish and sushi that can usually be safely consumed during pregnancy, up to 6 ounce servings a week. So toxin exposures for mercury, if you have, for example, fluorescent light bulbs do contain mercury. They won't be released unless that light bulb breaks. So if you do have a fluorescent light bulb that breaks, even the compact fluorescent light bulbs, the CFLs, if they break, they do have mercury. So do not use a vacuum to clean it up, because the mercury will get into your vacuum, and then when you vacuum, you're going to spread mercury all over your whole house. So do not vacuum it. You basically, need to, get gloves and try to clean it up as much as possible, and try to limit your exposure. I usually tell people to try to avoid fluorescent lights as much as possible. LED lights do not contain mercury, and so those are energy efficient lights that don't have mercury in them. So if you are, let me see. So if you are pregnant, basically asking an adult or someone else who's not pregnant to throw away their, a mercury thermometer or fluorescent light bulbs, and of course trying to prevent them breaking. And then also, if you are exposed to mercury at your job, then you want to talk about safety precautions, maybe switching to a different position where you're not exposed to those things. So everything that you can do to try to avoid those exposures. Bisphenol A, that is a toxin that is used in plastics manufacturing. And so this was a study that found that urinary BPA was 3 times greater in the autism group than in the control group. So it is something that has been linked to autism. It's also been linked to high blood pressure, reproductive conditions, asthma, obesity, and breast cancer. So all of those things. There's mounting evidence that exposure during pregnancy may lead to negative outcomes. Prenatal BPA exposure has been linked to aggression in 2-year-olds, as well as anxiety, depression, and poor emotional control in girls. That particular study was just looking at girls. Avoidance of BPA products, that's really the best way. There's no really well-known ways to remove BPA from the system once it's in your system. So trying to avoid and limit your exposure as much as possible is going to be really critical. So BPA is used in many different products to harden plastics. It's present in the lining of canned goods, so just all the regular cans, there's BPA in the lining. There are some cans that do use BPA-free cans. I'll talk a little bit about that though. There's some evidence that even the BPA replacements may sometimes be just as problematic as BPA. So I usually tell people to try to avoid canned foods as much as possible, trying to go with like fresh foods or frozen foods or things like that. Plastic bottles and plastic wrap, it's kind of impossible to avoid all plastic, but definitely you should, for sure, you definitely should not microwave anything that's in plastic, because heating plastic will definitely release a lot more of those compounds into your food. Trying as much as possible to avoid using plastics, trying to replace your plastic Tupperware with stainless steel or glass containers. I have a little one, so we have a lot of stainless steel containers, so it's not breakable like the glass ones. Also soda cans, coffee pots, a lot of our coffee mugs, we heat them up, right? And a lot of those are plastic. Also plastic and paper cups, dental sealants, cash register receipts. So trying to minimize your exposure as much as possible. I know that for a lot of our foods, it's almost impossible to get it without plastic, but if you have to get something in plastic, usually trying to, as soon as you get home, trying to take it out and then put it into like a glass or stainless steel container or something like that. Is BPA absorbed into the body? So they found that that 93% of people who were tested had BPA in their body. And it also has been found in breast milk and in newborn babies. So we do know that BPA crosses the placenta. So that's another reason to try to avoid as much as possible. And this is the one that I talked about. This is from the National Academy of Sciences that found that bisphenol S, which is a replacement used in BPA-free products, equally affects neurodevelopment or the development of the brain. So when you have the BPA-free plastic water bottles, usually I say just try to get like a stainless steel or glass water bottle instead. And definitely those water bottles that we get to drink, I tell people try not to get bottled water and just getting a really good water filter. That saves you money anyway, usually in the long run. Other toxins to avoid, we don't have time to get into all of these things, but these are definitely known and to be linked with autism. So lead, mercury, arsenic, heavy metals, flame retardants, pesticides, herbicides, parabens, PCBs, trying as much as possible to get organic because of the the pesticides and the link with herbicides. There's something called the Clean 15 and the Dirty Dozen, if you just Google it. That is, most of us can't afford to get everything organic. So the Clean 15 are usually the foods that if you get it non-organic, it's usually okay. It's been found to have lower levels of pesticide residue. The Dirty Dozen are foods that are the most important to get organic, that tend to be the most polluted. So those are helpful. Thyroid problems in pregnancy. Hypothyroidism for a mom during pregnancy has been found to increase the risk of autism. So as much as possible, having that hypothyroid condition properly treated during pregnancy is really important. It's also been found to increase the risk of ADHD as well. So the thyroid gland is also very sensitive to environmental toxins. So whenever I have people with hypothyroidism, we will typically screen for heavy metals as well, because heavy metals and toxins can definitely cause thyroid problems. Nutrient deficiencies. So folate, that B vitamin I talked about, that's really important for brain development, that's super important in pregnancy. So at average daily folic acid intake, so folic acid is the synthetic form. I usually tell people just get it through your food, just natural foods that are rich in folates, and you can see all those foods over here on the right-hand side. So an average daily intake of folate of more than 600 micrograms during the first trimester of pregnancy was associated with a reduced risk of autism. And also, the association between folic acid and the lower autism risk was stronger in mothers who had a genetic mutation that's called MTHFR. And I'll talk a little bit more about that. MTHFR is a genetic mutation that affects the way that your body processes folic acid. So if you have that genetic mutation, eating a diet that's really rich in natural foods, natural folate food sources is really important. If you have that genetic mutation, you actually want to avoid synthetic folic acid. So I'll talk a little bit more about that as well. Vitamin D deficiency during pregnancy has also been associated with an increased risk of fetal brain abnormalities as well as infantile autism. So that's another thing. We do get our vitamin D naturally from the sun, but it is a balancing act. I mean, you obviously don't want to get sunburn, increased risk for skin cancer. So I tell people a general rule of thumb is to get some sun exposure without a sunscreen to the extent that, according to your skin, you won't get pink or you won't get red. Because once your skin gets pink, that is a sign that there's been damage to the skin, and that's an increased risk for skin cancer. So everybody's skin is a little bit different. So, but trying to get sun exposure where you can, where you don't get pink, ideally, or red. Other than that, oftentimes we have to supplement with vitamin D. And so this is just another study on vitamin D. Iron deficiency. Iron deficiency during pregnancy is also associated with a higher risk of autism as well. So getting enough iron, particularly through foods, is really important in pregnancy. And then just some general foundations for a healthy diet before, during pregnancy, and then in early childhood. So avoiding processed foods as much as possible, especially a lot like the sugary foods and the candy and cakes and all that kind of stuff. I mean, definitely special occasions, but trying as much as possible to kind of avoid what most people look at as junk food, right? Lots of vegetables. Inflammation is known to be a problem in many mothers that have a child with autism, as well as children who have autism. And so there are foods that help to decrease inflammation. And not surprisingly, a lot of those foods are vegetables. So eat your veggies. Healthy fats. So coconut oil, olive oil, other cold pressed oils, low toxin fish like wild Alaskan salmon, nuts and seeds. Fermented foods are sources of they're natural sources of probiotics, which are good bacteria. So things like miso, tempeh, kombucha, kefir, yogurt, what else? Sauerkraut. There's beet kvass. So a lot of those are really great. Natto, if you like natto. So all of those are good sources of probiotics, natural sources of the good bacteria. and trying to eat local and organic as much as possible. Avoiding GMOs. There's not really clear research, I would say, in terms of a direct link to GMOs and autism, but I will say, just as a clinical observation, many of the children that I see with autism tend to have digestive problems that are associated with the top GMO crops, which includes wheat, corn, and soy. So that's just kind of a clinical observation. Before conception, I work both with families who have children with autism, and many of those families also say, you know, we want to have another child, but we're so scared that we'd have another child with autism. So they want to try to reduce the risk of having a child with autism. So there are things that we can do before conception, during pregnancy, and early childhood. So I'm going to go over some of those specific things. So in terms of conception, before conception, and then even if there's not a family history of autism, but if you just want to optimize health and wellness, I do work with couples or moms, dads before conception and then during pregnancy. And I do a lot of testing and go through a lot of these things. And then I can make individual recommendations for that particular person, test their vitamin D, test their iron, all of those things to make sure that things are optimal before you even get pregnant. And then also during pregnancy. So autism, there are studies finding that there are antibodies in some cases that the mother will make to attack the brain of the baby, of her fetus. And so trying to do everything that we can to balance the immune system before pregnancy. So avoiding foods that can cause, that are allergies or sensitivities, and that can help to kind of calm down mother's immune system, trying to keep it balanced as much as possible. There's a whole bunch of other things that I talk about with patients, but that's just a quick rough and dirty overview. And genetic testing, MTHFR is one of those genetic tests that I talked about, and that can be tested for. And you can also, before pregnancy, test the mother's methylation function. And methylation is one of those liver detox pathways that I talked about. And so if we can get all of that working well optimally before pregnancy, then we can help to reduce the risk of autism and help to optimize the health of both mom and baby during pregnancy. But the genetic mutations have been associated with an increased risk for miscarriage, having a child with autism and developmental problems, heart disease, and many other conditions. So that's where testing is really important. Also, trying to optimize nutrition, minimizing toxins. I have moms take prenatal, or what I call preconceptual vitamins before pregnancy, because most women don't even know that they're pregnant until several weeks into the pregnancy. And those first few weeks are some of the most critical times for baby's brain development. So it's really important. Ideally, I like to work with couples before they even get pregnant, so that the mom is already taking these things, so that by the time she finds out she's pregnant, she's already been taking all these nutrients. So you want to make sure that you have a multivitamin or a prenatal vitamin that is either based on whole foods, so it's sourced from whole foods, or that it has folinic acid or methylfolate, and not what said is folic acid, which is synthetic. Just in case mom has those genetic mutations, or just in case the baby has those genetic mutations, you want to make sure that you're taking the right form of folate. And there's a concern that some forms of chromium in some types of multivitamins can be carcinogenic. So there are specific brands that I will typically recommend based on mom's nutritional needs. I also test for heavy metals, having silver fillings removed by a well-trained dentist before conception, and then also testing for digestive imbalances and screening for thyroid problems. During pregnancy, you want to optimize nutrition, and also taking those prenatal vitamins as well, avoiding high mercury in farm-raised fish. Farm-raised fish have been found to have higher levels of a toxin called PCBs, or polychlorinated biphenyls. So trying to get wild-caught fish as much as possible, and avoiding the high mercury fish is important. I especially recommend avoiding vaccines that contain thimerosal during pregnancy. The flu shot is one of those vaccines that still does contain mercury, or still does contain thimerosal. So that is my recommendation, particularly if there's a family history of autism or increased risk. Also testing for hemoglobin and iron levels. So that's really important too, to make sure that the iron levels are sufficient. Also getting lots of folate, vitamin D, as I talked about. Omega fatty acids are important. Calcium is important. Having the right type of calcium, because there are some calcium supplements that have been found to have lead in them. So again, that's why I get pretty picky about specific types that I'll recommend. Also, during labor and delivery, avoiding artificial induction with Pitocin as much as possible. There has been a slightly increased risk associated with artificial induction with developmental problems. Also with epidurals, trying as much as possible to avoid epidurals and other medications as much as possible. For myself, I actually had a home birth and didn't use any pain medications. And people are surprised that within natural medicine, there's actually a lot of techniques. If you have a midwife or someone who's trained, there's actually a lot of techniques that you can use to help in dealing with the pain. So like the water tubs can be helpful. So there's a lot of things that you can do, because people are like, oh my gosh, you had a natural birth, like how did you do that? And people don't realize that there's many different types of different positions, different movements that you can do that can help. And then also, you know, in the hospital, lying on your back for many women is one of the most painful positions to give birth. And when you're in a hospital, a lot of times they'll put you right on your back, and that's the position where you deliver in. And I remember when I was in labor, that was the most painful position for me. And when I got out of, you know, when I could move around and be in a different position, then it was much more comfortable. So also avoiding C-sections as much as possible. So there is a slightly increased incidence of children who have autism who are born both by emergency as well as elective C-section. I mean, I understand in certain cases, I mean, you got to do that, you know, if it's truly an emergency. But definitely with elective C-sections, trying to avoid that as much as possible. Also going with an OBGYN who has a pretty low C-section rate, because there's quite a lot of differences of opinion among OBGYNs in terms of when they will actually consider a C-section really medically necessary. And so if you have an OBGYN who tends to be more conservative and won't just first thing jump right to a C-section, then choosing a proper OBGYN is really important for that too. Infancy and early childhood, there is a study that has found that it looked basically at babies who are given the Hep B vaccine on the day of birth, first or second day of life, versus babies who were never vaccinated with the Hep B vaccine or who received it after the first month of life. I don't know why they grouped the one that never got the vaccine versus the first month of life altogether, but that was how they did the study. In that particular study, they found that the risk was only with baby boys, but boys who were vaccinated in the first few days of life had a 3-fold greater risk for autism compared to boys who were never vaccinated for Hep B or who received it after the first month of life. So I will say one caveat to that: if the mother is Hep B positive, or if anyone who is in close contact with the child in the early stages of the child's life has active Hep B, by all means, I say absolutely the child should get a Hep B vaccine on the first day of life, because that can cause a lot of problems. However, if the mother is Hep B negative, and it's part of the standard prenatal screening that they test you for Hep B, if mom is Hep B negative and nobody in the close contact with the child has an active Hep B infection, the risk of that child contracting Hep B is very low. And the child can always get the vaccine later on, like after the first month of life. But that, again, is just per this study. Hospital birth, trying to get out of the hospital as quickly as possible. There's a lot of very antibiotic-resistant bacteria in the hospital. So trying to get out of the hospital as soon as is healthfully possible. Breastfeeding as long as possible. Introduction of solid foods. I generally recommend waiting until about 6 months of age when the baby's digestive tract is ready to start on whole foods. or not whole foods, but on solid foods, usually pureed. I usually say to space them out by at least 4 days, if not longer, so that you can look and watch for allergic reactions or signs of sensitivities or allergies. And I usually say to wait to introduce gluten until a year old. Supplements, fish oil, probiotics, vitamin D are typical things that I will recommend in early childhood. And these are just some quick cases. So this is a 3-year-old male who had a diagnosis of autism. He had tantrums when he first came to see me about 10 times a day. He would bite his siblings, kick his parents. He would wake up in the middle of the night screaming loudly, banging his head. He had digestive symptoms, so he had mucus in his stool, super foul smelling stools, very sticky, and they were either very hard or very loose. It was one extreme. It was never in the middle. His expressive language, parents said if he was calm, he could say, I want, in the name of the food, I want milk. But he would not produce words with any other situations. He would babble to himself and to his family, but sometimes most of the time it was just kind of babbling, it wasn't clear words. He was completely unaware of danger. He would take off. He almost got hit by a car. And receptive language, he could understand simple instructions. He would understand 2-step instructions, but he couldn't understand tones of voice or facial expressions. So when we tested him, so again, these are things that we tested over time. I don't do this all in the first visit. And these are things that we test over time. And I base the testing on the child's history, what seems to be most important for that child. So on the lab results, we did find that child had an overgrowth of yeast as well as disease-causing bacteria, had chronic oxidative stress, which basically just means inflammation. That child did have impaired methylation or the liver detox pathways. That was a problem, and also had vitamin D deficiency. So for that child, I recommended a gluten-free and dairy-free diet. Also, we treated him with antifungals as well as antibiotics for the yeast overgrowth and for the bacterial overgrowth, digestive enzymes, cod liver oil to help with brain function, and I recommend a specific type of multivitamin, probiotics, melatonin to help with sleep, B12, folinic acid, and an amino acid. Again, these are not things that we did all on the first visit. These are things we did over time. So. And after 6 months of working with me, parents said his tantrums were much, much more mellow. They went down from 10 times a day to once or twice a week. His sleep was good. He could sleep through the night. He wasn't waking up screaming anymore. Initially, they used melatonin to help him get into a sleep rhythm, but then now they said now he can pretty much fall asleep on his own. I see commonly a lot of children with autism when they have a lot of inflammation, if they have acid reflux, if they have gut problems, then they tend to have difficulty falling asleep or tend to have sleep problems. I've had some kids where literally the parents tell me, my kid sleeps 2 hours a night and then he's up almost the whole rest of the night screaming. Like I've had kids like that in my practice. And invariably when we get the medical conditions treated, we get the digestive system problems treated, we get liver problems, we decrease the inflammation, we find that the child is just, they're feeling better, they're more comfortable, they're not having all of this discomfort in their body, and then they're able to sleep. I mean, if you think about it, if you or I were in chronic pain, how well would we be able to sleep? Probably not that well, right? So it's the same with our kids. And as his expressive language had improved, so they could get him to say, he could say things to family members, and he surprised his pediatrician by going up to him and saying hi. And the pediatrician was like, oh my gosh, wow, what happened to your son? And he was putting more words together into sentences. And his receptive language, he was responding more. You could ask him questions. He knew his colors. He was interested in books. His digestive system, completely, the mucus, the foul smelling and sticky stools completely resolved with taking gluten and dairy out of his diet. He had normal daily bowel movements, which are soft and form, no pain with stools. There was one day that he drank a carton of milk and then he didn't have a bowel movement for 2 days. So parents were like, okay, we definitely noticed that's a problem. And then the teachers found that every time they would give him milk, he wouldn't have a bowel movement. He would stare off into space. He wasn't responding. He just wasn't aware. And later on, we did test this child, and we did find that he did have the folate receptor antibodies. So basically, dairy was causing more inflammation in his brain and making him more spacey. So this is another case of a 4-year-old boy. He came to me when he was 2 years old. He used to imitate parents when he was 3 years old, and he had several words. When he's 3 months old, and he had several words. And then after his MMR shot, he had constant diarrhea for 2 weeks. He'd have literally like 10 bowel movements a day, frothy, smelly diarrhea. And then mom said after that he wouldn't turn to look at them when they called his name. He had 2 more shots, and then after that he started flapping his hands, started stimming. He would spin in circles. He would walk on his toes. He lost all language, all his words. He would only make noises, but it would be out of context. Minimal social interaction, eye contact, and then he became constipated. He wasn't constipated before. So we started a diet free of gluten, dairy, and soy, and we also started shots of vitamin shots that had B12, an amino acid called NAC, and folinic acid. And he had dramatic improvement with that. And he did have yeast overgrowth. We did a round of an antifungal medicine and also did different oral vitamins and minerals over the years. At 4 years old, mom had to have him re-diagnosed to see if he even still qualified for an autism diagnosis, because she said now he essentially, this is one of the cases where essentially he pretty much recovered, because he really didn't look like he had autism anymore. Mom was like, he has friends, he's social, he'll initiate interaction with other people. His language was pretty much normal for his age. He would make friends. Before he had a lot of sensory issues. He couldn't tolerate the feel of sand on his skin, and then after that he could be able to go to the beach and play in the sand. It was fine. The only concern that mom had was that he was still somewhat of a picky eater, and that she did say she had some concern about attention and focus. And a caveat, I unofficially kind of consider ADHD to be kind of on the spectrum. Interestingly, I see a lot of families where they have one child with autism and then they have another child with ADHD. And that was the case in my family, with my siblings. And we also see cases where a child like this is diagnosed with autism and then gets better slowly, and then is later loses their autism diagnosis and then is later diagnosed with ADHD. So it doesn't mean that all kids with ADHD have autism. But I see a lot of the same medical issues in ADHD as I see with autism. So this is another case, a 9-year-old male. He was previously diagnosed with autism and verbal apraxia. At 2 years old, he had a 10-word vocabulary, started having autistic behaviors. 3 years old, he was diagnosed with pervasive developmental disorder. He was getting speech and occupational therapy. He had a 40-word vocabulary. After 10 months of a special education preschool, but he was a poor sleeper, limited food choices, tantrums, and he was inattentive. And lab testing found food allergies, yeast infections, viral infections, problems with liver detox. Let's see. Oops. Let's see. Oh, okay. Okay, there we go. Is that working? Okay. So he started on a gluten and dairy-free diet, gave him digestive enzymes, cod liver oil, a multivitamin, probiotics, B12. These, again, are things all over time. And there's gradual improvement over the years. Again, for that child, the 2-year-old child that recovered, I mean, you have to remember that this was not an overnight thing. This was a gradual change over a course of 2 years. But mom did see improvement. Same with this child. Gradual improvement over the years. There are multiple medical treatments. Also a special ABA school, applied behavior analysis, and when he was reevaluated, lost his autism diagnosis, and his only current diagnosis is dyslexia. So that's it. And so I do want to thank you again. And again, we have a sign-up sheet for a free 15-minute phone consult. And so if you want to sign up for that, and so that you can have a chance to talk with me, we can answer more questions individually about individual concerns that you have for your child or for you or for other kinds of things. I also do general family medicine as well. So if you have other kinds of conditions, I see a number of digestive system issues, autoimmune conditions, hormonal issues, migraine. So I see all of those things too. So if you do have questions or want to sign up for a free 15-minute phone consult, then we do have that. So yeah, and then now I will just take questions. So yeah.
So if they stop the treatment, will they get an autism diagnosis back?
So
if they stop the vitamins and all that.
Oh, okay. So the question was, if the children stop the vitamins, then would they get diagnosed with autism again? The short answer is it depends. I've seen some children where we get them better, and then when they stop the vitamins, then they start to regress and start to lose skills again, so we have to start back on things. There are other children that I've seen that have improved to the point that we don't need to continue all like the super intense vitamins and everything like that, and they can just maintain with basic types of things like a multivitamin or probiotics and other kinds of things, and they're fine. And that, I think, is really linked to the genetics too, because we're all different. And I talked about the genetic mutations. So generally, the more genetic mutations there are, or if the child has folate receptor antibodies, they will usually need to be on folinic acid for the rest of their life. But the short answer is it depends. Yeah, so the question was if they were on a special diet like gluten, casein, or soy. So I'm repeating it for the sake of the Facebook Live people. But if they were on a diet free of gluten, dairy, and soy, and then you reintroduce those things, then does the child regress? And again, with that, it also depends. I've seen children where we were able to get them off of the diet, and they were able to just eat normal foods, and they were fine. I've seen other children where when we start to reintroduce those foods, then they start to backslide. So, yeah. Yeah. Question? Yeah, so the question is if I know any dentists in the area that are properly trained in mercury removal. So I do. I refer commonly to Dr. Tony Kim. Anthony Kim. And he's actually, for those of you who are here in person, he's actually right across the street. So yeah, he's in the building right over there. So he's really great. And then also Dr. Chad Kawashima. I've had a number of patients that have gone to him who've had mercury fillings removed and have been really happy with that. I will say also that the proper training in mercury removal is super important. I've had some patients who came to me after the fact where they told me, I had my mercury amalgams removed, and it was by a dentist who wasn't properly trained. And I've seen a whole gamut of reactions. I've seen some people who got tremors. I've seen some people who had seizures. I've seen some people who have marked neurological issues, some people who developed headaches. Some of them were short-term, some of them were actually long-term. So the proper mercury removal is really important, because if it's not removed properly, then while they're removing it in that process, mercury will release gases, and if it's not removed properly, you can potentially be releasing more mercury into the system than you were when you just had the filling. So. Yeah. So the question was about other types of dental procedures, so root canals, things like that. If that can increase the risk for if that can increase the risk for like autism or adverse or just autoimmune, or I think you said autoimmune issues, immune system problems. I'm not aware of research linking root canals with that. I haven't done a literature search on that. So a really good resource, by the way, if you want to look up actual research studies, is Google Scholar. So if you just look up Google Scholar and you type in search words, then that will pull up actual research studies. Because, there's so much information, misinformation on the internet. But Google Scholar is a great resource. and then you can go and look up actual research studies. So that might be an interesting, there may be, I haven't done the literature search for that. Yeah. Other questions? So the question is, what is your experience with autism and IVF? I will say that I do have a number of families where they've had IVF, and I've had some IVF families where they have multiple children with autism, and or children with autism and then ADHD. I would really have to look at the research on that, because that's again one of the things I haven't looked up in the research. I think that would be a really interesting thing. And is it a question? I have heard of some studies that suggest that there may be an increased risk of autism with IVF. I think some of the questions there, though, are: is it actually the IVF procedure, or is it the fact that there were already problems with conceiving, with already problems with being able to get pregnant? So endometriosis, when there's inflammation, and also when there are issues with MTHFR, that genetic mutation. MTHFR and other genetic mutations can increase the risk for infertility, and that also increases the risk for autism. So, is it the IVF, or is it the fact that there were other pre-existing conditions that are known to be increased risk factors for autism? It could, yeah, it's hard to say. Other questions?
Yes. Are most of the testing tests that you do for lab work, is it mostly covered by insurance, or is it basically not pocket?
So the question was, as far as the testing that I do, is that mostly covered by insurance, or is it mostly out of pocket? It depends on your insurance, actually, because for some insurances will cover some of these specialty labs. For a lot of there's a lot of typical tests that I can run through DLS or clinical labs, and those are typically covered by insurance, things like vitamin D and iron. And so there's a lot of tests that are usually covered by insurance, and then there's some of the specialty tests that are not covered depending on which insurance you have. So for that, I always tell families, if finances are a concern, talk with me. I mean, you can talk with me at the 15-minute phone consult about that, because that is really important for us to be able to get families the care that they deserve and that they want to access. And we have a variety of different payment plans. There are also scholarships that will cover the cost of my office visits and other types of specialty labs if your insurance doesn't cover those. So there are scholarships that are available, and we really try to work with people in terms of finding out what we need to do to make it, just so that you can access the care that you deserve. So, Caitlin, could you also check on the Facebook Live to see if there are any people that have questions from Facebook Live? Yeah, so if anybody on Facebook Live has questions, they can type in those questions, and Caitlin can shout them out. For right now, any other questions or concerns? So, yeah. And then for those of you who are familiar with the Keli'i Foundation, the Keli'i Foundation is a nonprofit organization that does raise funds to help with, one of the things is that we're raising funds to help with scholarships where patients, if their insurance doesn't cover some of these specialty tests or other types of things. And so just some information on the Keli'i Foundation. If you just go to keli'ifoundation.org, you'll find information. We are having a gala that's coming up in October, and the gala is really to help raise funds for all of that. So I'd encourage those of you who are interested in that to look for that. And we have raised funds from previous fundraisers. So the Keli'i Foundation actually will be announcing a scholarship that's going to be coming up. The deadline should be coming up pretty soon, the next few months. And that scholarship will be made available to help families with children with autism. So, yeah. And any questions coming in on the Facebook Live? No. Okay. So again, thank you for coming. And if you have specific questions, if you want to come up and talk to me afterwards, then you're welcome to do that. And for those of us who are joining us on Facebook Live, thank you for joining in. So thank you so much. Thank you.